Hi everyone, welcome to today's program. It's a very special and important day because we're learning about the Urgent Care Center here at the Allied Pacific Supercenter. The medical director is with me, Dr. Nick Kwan. Dr. Kwan, tell us about your new Urgent Care Center.
Hi Trevor. Hi everyone. The Urgent Care Center is not like other Urgent Care Center that you see. The difference is here is we treat all the common complaints from headache, fever, abdominal pain, extremity injuries, but in addition, we have the capability to refer our members to instant authorization to a subspecialist. So if let's say you come in on a weekend with abdominal pain, and I found that, instead of going to the ER, I could do all my diagnostics here, and you may have a very subtle GI bleed, what we call it, and you may need urgent colonoscopy. Well, the average wait time for colonoscopy and endoscopy, it's 6 months to a year sometimes. Well, what this urgent care does is I can send an instant authorization to our clinic, GI clinic upstairs, and you may be seen within a week and possibly schedule a colonoscopy if necessary.
Literally upstairs, not figure. It is literally
upstairs.
It is
upstairs. It is upstairs. It's called a Supercenter because it's got multi-specialties. We even have neurosurgery, we have dermatology, we have GI as we talked about earlier, and we have OBGYN, women health. We even have lab draws here.
All right.
And we have a pharmacy.
If you drive by, you might not even know this is an urgent care center. It's such a modern, beautiful building. You have to see it to believe it. Tell me the difference between going to the ER and coming to your urgent care center. Are they the same thing?
In the perspective of the patient, I would say in their mind, it's probably going to be similar. The difference is going to be less weight here because, it's easily accessible. However, if the patient ever feels, hey, do I need to go to urgent care ER? I don't know. We can re-triage the patient immediately. Let's say you have a chest pain and God forbid you have to go to the ER. Our providers here are ED trained and they can recognize that and advise, Garfield Medical Center is next door. We have St. Gabriel Valley Medical Center around here. We can re-triage the patient to the ER. Patients may ask, oh, what about x-rays, CTs, and all those imaging, right? They have that in the ER in the hospital. How do we do that here? Well, the difference is we have partnership with facilities that can perform CT and x-ray, maybe 2 5-minute drive away from here. So if we think that in your case, if you have abdominal pain or ankle sprain, you need an x-ray or CT, we can get that done for you, and the results will be back in 60 to 90 minutes.
That's wonderful. So how has it been so far? Do you feel like the community is responding and understanding the services that they have here?
I think we've been busier than usual. We are noticing that on the inconvenient times for primary care physicians where they're unable to accommodate these patients, we can take them as walk-ins from things as simple as COVID testing to prescription refills for their hypertension, for their diabetes.
Was this like an emergency where you're open 24/7 or is there certain hours?
No, there are certain hours. We're open 9 to 9.
9 to 9.
Right, so we take the peak hours away, the rush hours, and we can treat the patients.